Hello there, welcome back to my channel. And in this video session, I'll be dealing with the menstrual cycle. And the menstrual cycle is also referred to as the female sexual cycle. I feel the better word for menstrual cycle is the female sexual cycle. And this menstrual cycle or the female sexual cycle is one of the most important topics in your reproduction. It is one of the topics which is also asked as a long essay. So stay till the end of the video in order to understand the concept behind this so-called female sexual cycle, and I 100% guarantee you that this video is going to be very helpful for you for the sake of your exams. So let's begin with what are the objectives of this video. So first, let's understand the definition of the menstrual cycle or the female sexual cycle. And always remember that in the female sexual cycle or in the menstrual cycle, there are two things which are occurring simultaneously. One is the changes are occurring in the ovary. The second is there are changes which are occurring in the endometrium. Sometimes they will ask you a specific question as to describe the stages of ovarian cycle in the menstrual cycle. So ovarian cycle is a part of the menstrual cycle or a female sexual cycle wherein the changes are occurring only in the ovary. Now simultaneously there are also changes occurring in the endometrium. So that is called as the endometrial cycle. So in this video we are going to study both the ovarian cycle as well as the endometrial cycle. Okay, and one more important aspect which we are going to understand is the mechanism of ovulation, or it is also referred to as the endocrine signaling, which is going to lead to the ovulation, or simply we can call it as the mechanism of ovulation. Fine. So I think I'm pretty clear in this. So there are two events which are occurring. One is the changes which are occurring in the ovary, that is called as the ovarian cycle, and the changes which are occurring in the endometrium, that is called as endometrial cycle. These two changes are occurring simultaneously. So these two are the subtopics of what is called as menstrual cycle. So if the question is asked to describe the stages of the menstrual cycle, then you are supposed to write the stages of both the ovarian cycle as well as the endometrial cycle. But sometimes they are going to only ask you describe the changes which are occurring during an ovarian cycle. Remember that thing. At that point of time you are only supposed to write regarding the changes which are occurring in the ovaries. Or sometimes they will ask you only the changes which are occurring in the endometrial cycle. At that point of time you are supposed to write only the stages and the changes which are occurring in the endometrium in a female sexual cycle. Okay, don't mix the stages of the ovarian cycle with that of the endometrial cycle. These are different structures and the changes are also different. So the female sexual cycle, as to what is its definition: monthly rhythmic changes in the rates of secretion of the female hormones, okay, and corresponding physical changes which are occurring both in the ovaries and the endometrium. There couldn't be a better definition of this so as to understand as to what is a female sexual cycle. So what is happening is that there are physical changes which are occurring both in the ovaries as well as in the endometrium. That is why we are having an ovarian cycle and an endometrial cycle as a subtopic of the female sexual cycle or the menstrual cycle. Now, why these physical changes are occurring in the ovaries and the endometrium is because there is going to be rhythmic changes in the rates of secretion of the female hormones. That is, the female hormones are never constant over a period of 1 month. There is going to be a high and a low and a high and a low. Now, because of this rhythmic changes which are occurring in the secretion of the female hormones, there are corresponding changes which are occurring both in the ovary as well as in the endometrium. This is what is the definition of the female sexual cycle. Now, the duration of the cycle when we speak theoretically, so as to describe the cycle, we take the average as 28 days, but very rarely it is 28 days. So that's why we have a big range for the duration of the cycle, which can be from 20 to 45 days duration. Okay, that's the duration. So during this female sexual cycle, two significant events are occurring. Two very important events are occurring. So what are these two significant events? One is there is going to be release of a single ovum each month. Okay, even though there are two ovaries, there is going to be release of only one ovum each month. And second significant event is the uterine endometrium is going to prepare itself for the implantation of the fertilized ovum. Okay, so these are the two important events which occur during a female sexual cycle. So as I told you before, there are two things which are occurring simultaneously. One is changes in the ovary, which is called as the ovarian cycle, and another one is simultaneously there is also change which is occurring in the endometrium, which is called as the endometrial cycle. Okay. Okay, first let's understand the ovarian cycle. Now the changes which are occurring in the ovarian cycle can also be referred to as folliculogenesis, because what is happening is there is going to be development and maturation of the follicles. Now before going into folliculogenesis, I would like to give you a brief introduction, and this introduction is also very important. Remember that no new ova are formed after the birth. Whatever ova is there, they are formed only during the fetal life. Now at birth, there are around 2 million ova which are present in the ovary, and out of this 2 million ova, 50% are atretic, that they have already undergone atresia. So only 1 million ova is remaining at birth. So these 1 million ova, what type of ova it is already in the stage of the primary oocyte, and this primary oocyte has already begun the first stage of meiosis 1. But the first stage of meiosis 1 is not completed because it is arrested in the stage of prophase. So when is it that the meiosis 1 is going to get completed? Meiosis 1 is going to get completed just before the ovulation. So at the time of ovulation or just before the ovulation, the meiosis 1 gets completed and the primary oocyte is going to form a secondary oocyte. So now after the completion of the meiosis 1 and formation of the secondary oocyte begins the meiosis 2 phase. And what is going to happen here is that the meiosis 2 is again arrested in the phase of metaphase or in the stage of metaphase, and it remains so till there is fertilization of this secondary oocyte. Okay, till there is fertilization of the secondary oocyte. So because of the constant atresia of the ova, at the time of the puberty there are only 300,000 follicles or ova which are present in the ovary. Now, this is a brief introduction before going into the stages of the ovarian cycle. So ovarian cycle is having three important stages. The first stage is what is called as the pre-ovulatory stage, or it is also called as the pre-ovulatory phase. The second phase, rather than calling it as a phase, I would call it an event, which is ovulation, and the third is the post-ovulatory phase. So there is an ovulation. This ovulation is going to typically occur on the 14th day of the cycle. So that means 1st to 13th day of the cycle is what is called as the pre-ovulatory phase. On the 14th day, there is going to be ovulation, and 15th to 28th day of the cycle is what constitutes the post-ovulatory phase. So remember, the phases of ovarian cycle are with respect to the ovulation. There is a pre-ovulatory phase, there is an ovulation, and then there is a post-ovulatory phase. So first let's understand as to what is this pre-ovulatory phase. there are so many stages of development of the follicles which occur in the pre-ovulatory phase. So we always start with this stage, which is the stage of the primordial follicle. So the first stage is the stage of the primordial follicle. So what is a primordial follicle? A primordial follicle is nothing but a secondary oocyte. Sorry, it's not a secondary oocyte, it's a primary oocyte, and this primary oocyte, or also simply called as the ova, is surrounded by flat granulosa cells. So a ova surrounded by the flat granulosa cells is what is called as a primordial follicle. Now this primordial follicle is going to develop into primary follicle, which is the second stage. Now what changes occur when the primordial follicle becomes a primary follicle? There are three very important changes which are going to occur here. The first change is that the flat granulosa cells here, they have become cuboidal. Here we can see in the diagram, they have become cuboidal. The second change is that here we can see that there is an increase in the size of the primary oocyte. And the third change is that we can see that there is appearance of a membrane between the oocyte and the granulosa cell, and this membrane is what is called as the zona pellucida. So these three changes are seen at the stage of the primary follicles. Now the primary follicle is going to develop further into the next stage, which is called as the secondary follicle, or it is also called as the preantral follicle. Now what is happening at the stage of the secondary follicle is that here we can see that there is proliferation of the granulosa cells, first thing. Second thing is that there is a further increase in the size of the primary oocyte, and the third change is there is appearance of one more layer of cells outside the granulosa cells, and these are called as the theca cells. So this is the stage of the secondary follicle, or it is also called as the preantral follicle. Now the secondary follicle is further going to develop basically under the influence of the follicle stimulating hormone into what is called as the tertiary follicle. The tertiary follicle, you can just use the word tertiary follicle. And in this tertiary follicle, again we have two subtypes. One is called as the early tertiary follicle, and another one is called as the late tertiary follicle. Or the early tertiary follicle is also referred to as the antral follicle, and the late tertiary follicle is also referred to as the preovulatory follicle. Now when this preovulatory follicle is mature enough, okay, at that point of time the preovulatory follicle is also called as the Graafian follicle. Okay, all is same. So let's understand as to what changes occur in the so-called the early tertiary follicle or the antral follicles. So what happens is there is further proliferation of the granulosa cells, and under the influence of the follicle stimulating hormones, the granulosa cells, they begin to secrete a fluid which is called as the follicular fluid. Okay. Now because of the secretion of the follicular fluid, there is an appearance of the cavity. Here you are seeing there is an appearance of a cavity in between the granulosa cells. So this cavity is what is called as antrum. That's why these follicles are called as the antral follicles. Further, again under the influence of the follicle stimulating hormones, there is an increase in the secretion of this follicular fluid. So because of this increase in the secretion of the follicular fluid, few of the granulosa cells, they remain attached to the primary oocyte and the zona pellucida. So surrounding the zona pellucida, few of the granulosa cells will be there, and remaining granulosa cells, they become separated. Okay. So the granulosa cells which are attached to the primary oocyte and the zona pellucida, those are called as cumulus. And the granulosa cells which are separated from them, those are called as the mural granulosa cells. So now we are having two types of granulosa cells. one which is surrounding the oocyte, which is called as the cumulus, and the one which is lining the inner surface or lining the surface of the follicle, that is called as the mural granulosa cell. This is occurring because of the increase in the secretion of the follicular fluid, and hence there is an increase in the size of the antrum. One more very important change which is occurring here is that the theca cells, which I had told you, these get differentiated again into two layers. One is called as the theca externa, another one is called as the theca interna. The theca externa is going to become the capsule of the follicle. It's going to be the outermost layer and the capsule of the follicle, and the theca interna is going to secrete both the estrogen as well as the progesterone. Remember, even the granulosa cells also secrete more of estrogen, and the follicular fluid which is produced and which is there in the antrum, that is also rich in the estrogen. So the secretion of estrogen and progesterone, which is occurring both by the granulosa cells as well as the theca cells, is under the influence of a very important hormone which is called as the follicle stimulating hormone. So this stage of pre-ovulatory follicle is also called as the Graafian follicle. So just I will give you the summary of the different stages. The first stage is the primordial follicle, which is nothing but a primary oocyte surrounded by flat granulosa cell. Second is the primary follicles, wherein three important changes occurs: increase in the size of the primary oocyte, appearance of a membrane between the oocyte and the granulosa cell, which is called as the zona pellucida, and the flat granulosa cells are going to become cuboidal. Next is a stage of secondary follicle, or also called as the preantral follicle. Here what is happening, there is further increase in the size of the oocyte, there is proliferation of the granulosa cells, and there is appearance of one more layer of cells outside the granulosa cells, which are called as the theca. Then comes the stage of the tertiary follicles, which are again divided into early tertiary and the late tertiary. Early tertiary is also called as the antral follicles, and late tertiary is also called as either the preovulatory follicle, or it can be also called as the Graafian follicle. Now, what is happening in the antral follicle or the early tertiary stage is that the granulosa cells, they proliferate and they also begin to secrete a fluid which is called as the follicular fluid, because of which there is an appearance of the cavity within the granulosa cells. Now again, further under the influence of the follicle stimulating hormone, there is more amount of secretion of the follicular fluid, because of which the granulosa cells, few of them they stay attached to the oocyte, and few of them they become separated from the primary oocyte. So those granulosa cells which are still present surrounding the oocyte, that is called as the cumulus, and those which are separated and which are actually lining the surface of the follicle, those are called as the mural granulosa cells. And then the theca again differentiates almost at this stage into an theca externa and an theca interna. Theca externa forms the capsule, theca interna acquires ability for the secretion of both estrogen as well as progesterone. So this is how we are supposed to describe the different stages in the pre-ovulatory phase. Next, let's go to the ovulation phase. And what is ovulation? Ovulation is the release of the secondary oocyte. So what I was telling you is that till now it is in the level of the primary oocyte. Now in the first slide I told you that the primary oocyte gets converted into a secondary oocyte, wherein the primary oocyte finishes its phase of meiosis 1 and it gets converted into secondary oocyte, and now the secondary oocyte is arrested in the metaphase stage. So what is released out of the ovary is the secondary oocyte. So release of the secondary oocyte from a mature Graafian follicle following its rupture from the ovary into the peritoneal cavity. So as soon as the secondary oocyte is released, it is caught by the fimbriated ends of the fallopian tube. Now, if at all they ask you the definition of ovarian cycle, in a similar way as we define the female sexual cycle, you can define it as the monthly rhythmic changes in the rates of secretion of the female hormones, because of which there is corresponding changes which are occurring in the ovary. Okay. So next, let's understand the hormonal changes which are leading to ovulation. Now this is very important to understand. So now there is an interplay of four important hormones. Okay, first is the estrogen, second is the progesterone, third is the follicle stimulating hormone, and the last is the luteinizing hormone. So we all know that whenever the secretion of estrogen, okay, and the progesterone is going to increase, this is going to cause a negative feedback inhibition of both the follicle stimulating hormone as well as the luteinizing hormone. So this is a 28-day cycle graph. Okay, the shaded area is going to show you the first 5 days where there is menstruation which occurs, and this dotted line is the middle part of the menstrual cycle, which is corresponding to the 14th day of the menstrual cycle. On this day, ovulation has to occur. So here we are seeing, so this portion is exactly our pre-ovulatory phase. 14th day is wherein the ovulation is occurring, and this portion is where we have the post-ovulatory phase of the ovarian cycle. So during the pre-ovulatory phase, here we are saying the blue line represents progesterone and the red line represents the level of the estrogen. Almost the progesterone is not at all secreted in the first phase of the ovarian cycle. Its secretion is almost nil, or almost it is at the basal level. Okay, so as and when we progress from the beginning of the cycle towards the middle part of the cycle, what is happening is progressively there is an increase in the secretion of estrogen. Why this is occurring? Because the follicles are developing, more and more amount of granulosa cells are coming into play, the theca interna is also there, and more of all these cells are going to secrete more amount of estrogen. So as here we can see, as we are coming to the middle of the cycle, the level of estrogen is high. Okay, and as and when the estrogen levels increase, what has to happen to the levels of follicle stimulating hormone and the luteinizing hormones, which are nothing but the gonadotropins which are produced from the pituitary? Now, because of the negative feedback inhibition, both the levels of FSH and LH has to reduce. But exactly opposite of that occurs as and when we are nearing to the ovulation. So when there is an increase in the estrogen level, this increase in estrogen level is surprisingly going to cause an increase in both follicle stimulating hormone. Here we can see the follicle stimulating hormone is less. Just nearing to the ovulation, its level is going to increase, and there is a massive increase in the level of luteinizing hormone, which is called as LH surge. So what has happened is the negative feedback inhibition of the estrogen on the FSH and LH has got converted into a positive feedback inhibition. So increase in the level of one hormone has led to an increase in the level of two more hormones, which or else usually are under the negative feedback inhibition. So pre-ovulatory LH surge, which begins 36 hours prior to the ovulation and peaks 9 hours before the ovulation, is very important for the process of ovulation to occur. So this is a clear-cut example wherein a negative feedback inhibition has got converted into a positive feedback inhibition. Okay, now once the ovulation has occurred, there is formation of one more very important structure within the ovary, which is called as the corpus luteum. Now this corpus luteum is going to secrete both the estrogen as well as the progesterone, but the secretion of progesterone, as here we can see in the graph, is more compared to the secretion of the estrogen. Now again, because increase in the secretion of progesterone and estrogen, what has happened to the FSH and LH levels? Both the levels have fallen down. So only just prior to the ovulation, a negative feedback inhibition of the estrogen gets converted into a positive feedback. This is very much important. The most important thing which is required for the ovulation to occur is the LH surge. Now, how this LH surge is going to cause ovulation is what we are going to study next. Okay, so there is an LH surge Whenever there is an LH surge, there is also increase in the secretion of follicular steroid hormones like progesterones. Now, because of these things, because of the LH surge, two very important events are going to occur. Okay, the first event which occurs is what is called as follicular hyperemia. So what do we understand by the word follicular hyperemia? There is an increase in the blood flow in the follicle. Why there is increase in the blood flow? Increase in the blood flow is there because of generation of new blood vessels. Because of the generation of the new blood vessels. New blood vessels are formed. This is also called as angiogenesis. Along with the formation of new blood vessels, there is also prostaglandin secretion. So this prostaglandin is going to cause vasodilatation. So whenever there is a vasodilatation, what is going to occur from these blood vessels? Within these blood vessels, there is an increase in the blood flow, and because of increase in the blood flow, whatever plasma is present in these blood vessels, it is going to transudate into the follicle. Okay, so let's say this is the follicle and there are many blood vessels which are present inside this follicle causing follicular hyperemia. Whatever plasma is there from these blood vessels, it is going to enter into the follicle. So now what is going to happen? The size of the follicle is going to increase, which is called as the follicular swelling. On one side this is occurring. On the second side, what is occurring here is that the theca externa is going to produce proteolytic enzymes. Okay, and these proteolytic enzymes, they are going to cause weakening of the follicular wall. So usually what happens is one part of the follicle is going to expand like this because of the follicular swelling. Okay, that is the part of the that portion of the follicle towards which we are having the Graafian follicle, and this expanded portion or this elongated portion is what is called as the stigma. Okay, so ultimately because of constant follicular swelling keeps on occurring and weakening of the follicular wall, there is degeneration of this stigma. So because of the follicular swelling and degeneration of the stigma, this follicle is ultimately going to rupture, which is going to cause evagination of the ovum. So two important events: follicular hyperemia and release of the prostaglandins, and release of the proteolytic enzymes by the theca externa. So this is how it is going to look like. Isn't it beautiful? See, this is our stigma. What you are seeing, that is that expanded portion, and inside there is a follicle and there is rupture of the follicle and there is release of the mature ovum. So this finishes the ovulation. Next we have the next phase, which is called as the post-ovulatory phase. So what changes can we see in the post-ovulatory phase? So what has occurred here? There is release of the ovum or the secondary oocyte. Once there is release of the ova, the entire follicle will be filled by blood. Okay, and that follicle is now called as corpus hemorrhagicum. That's the first stage because it is filled with blood. After the filling with the blood, okay, within some time, whatever remaining granulosa cells are there and the theca cells are there, these granulosa cells and the theca cells, they become filled with lipid inclusions. So now these granulosa cells and the theca cells are what are called as the lutein cells. They are called as the lutein cells, and the structure which is formed is what is called as the corpus luteum. Okay, see here there is developing corpus luteum, and here we are saying because of the lipid, what has happened is this structure will give me an yellowish kind of color. So that's why this structure is what is called as the corpus luteum. So now this corpus luteum, which is formed under the influence of some hormones, basically the luteinizing hormone, the lutein cells are formed. Now this corpus luteum is going to secrete more amount of progesterone and also the estrogen. So this corpus luteum begins to secrete progesterone and estrogen for a period of approximately 6 to 8 days post ovulation, that is roughly till the 22nd or the 24th day of the ovulation. Okay. Now, if at all the pregnancy has occurred, then the corpus luteum keeps on secreting the progesterone till the secretion of progesterone is taken over by the placenta. But if the pregnancy is not going to occur, after around 23rd or 24th day, the corpus luteum begins to involute. Okay, it begins to involute and ultimately it is going to disintegrate. So this corpus luteum forms what is called as corpus albicans, and the level of progesterone and the estrogen are going to fall now drastically. So once there is a drastic fall in the levels of progesterone and estrogen, what is going to happen after the 28th day is there is going to be bleeding, and that is what is called as the menstruation. So remember, we have just after the release of the secondary oocyte, the first stage is what is called as the corpus hemorrhagicum. The second stage is what is called as the corpus luteum, and if there is no pregnancy, the corpus luteum is going to get converted into corpus albicans, and then this corpus albicans is all going to degenerate, and then there is going to be again the development from the stage of the primordial follicle. That's why it is called as a cycle. So these are the three stages of ovarian cycle. Remember, pre-ovulatory, ovulation and post-ovulatory phase. So what are the events? Just to summarize, the 6 to 13 days is wherein there is formation and maturation of the follicles. On the 14th day, there is rupture of the dominant or a Graafian follicle and ovulation. From the 15th to 23rd day, there is complete maturation of the corpus luteum, and the corpus luteum is going to secrete progesterone and estrogen. 24th day onwards, there is beginning of involution of the corpus luteum, and this leads to a drastic fall in the levels of both progesterone as well as the estrogen levels. See, this is how a real laparoscopic picture of the ovulation is going to look like. So that's the ovum in which we are having the secondary oocyte, and what is this? This is nothing but our stigma, which is that projection coming out of the ovary, and rupture is going to be there. Rupture is there. There is little bit bleeding also occurs into the peritoneal cavity. Okay, this is how it looks in reality. Next, we have the endometrial cycle. See, I have told you clear cut that the stages of the endometrial cycle is completely different from the stages of the ovarian cycle. So please don't mix up both the things. In the endometrial cycle, we are also having three phases which are corresponding with the three phases almost of that of the ovarian cycle. The first phase is what is called as the proliferative phase. The second is what is called as the secretory phase, and the third is what is called as the menstrual phase. The menstrual phase is the process of bleeding which occurs from the 1st to the 5th day of the menstrual cycle. Okay. After this, we have the proliferative phase, which is going to go from the 6th to the 14th day of the cycle, and from 15th to 28th day of the cycle, we are having the secretory phase. Again, the representation of the three phases, the menstrual phase here, wherein there is shedding of the endometrium which takes place for the first 5 days. After the shedding has occurred, again the endometrium begins to reconstruct itself and develop, which is the proliferative phase, which is going to go on for about 11 days. And then there is going to be the secretory phase, which will be there for 12 days. So there is a stark difference between the stages of ovarian cycle and the endometrial cycle. Again, I am telling, please don't get confused. Write as to what is being asked in the exam. If at all they are asking you ovarian cycle, write the pre-ovulatory phase, ovulation, and the post-ovulatory phase. If they are specifically asking you regarding the endometrial cycle, write the proliferative phase, secretory phase, and the menstrual phase. Okay, so first let's understand as to what is this proliferative phase. Remember that proliferative stage almost roughly coincides with the pre-ovulatory phase of the ovulation, because the proliferative phase is the one which is beginning from the 6th day and it is continuing till the 14th day of the cycle. So it is coinciding with the pre-ovulatory phase of ovulation, and the proliferative phase is basically under the influence of the hormone estrogen. Fine. So what is going to occur? So prior to the proliferative phase, what has occurred? There is shedding of the endometrium, and that is what is called as the menstruation. So now from the shed portion of the endometrium, this endometrium has to undergo a process which is called as epithelialization of the endometrium. That is, endometrium has to grow back now. Endometrium has to proliferate now. That is why this phase is called as the proliferative phase. So epithelialization of the endometrium, and from that basic stage, so let's say this is the endometrium from which it has to develop. From here, the thickness is going to increase to 3 to 4 millimeter from this basal part of the endometrium. Okay. So there is going to be mitosis of stratum basale to stratum functionale. So after shedding, whatever endometrium is remaining back, that remaining portion of the endometrium is what is called as stratum basale. So from this stratum basale, whatever portion is developing during the proliferative phase, that is what is called as stratum functionale. So there is going to be mitosis of the stratum basale to form the stratum functionale, and how much is the thickness which is going to increase? That is 3 to 4 millimeters. And once there is formation of the stratum functionale, there will be also formation of new blood vessels within this stratum functionale, which is called as angiogenesis. Okay, angiogenesis, formation of the new blood vessels. Okay, then these blood vessels are not just like the straight blood vessels we see in any other organs. These blood vessels are having spirals. Okay, this is what is called as spiraling of the blood vessels. Fine. Then there will be also, along with the spiraling of the blood vessels, remember, there will be also growth of the endometrial glands. The glands are also going to come in. So all these are very, very important points. Epithelialization of the endometrium, thickness increases to 3 to 4 millimeters. Stratum basale forms stratum functionale. Once the stratum functionale is formed, there is going to be appearance of the new blood vessels. These blood vessels are not the straight blood vessels, but they become spiraling, and then there is also growth of the endometrial glands. Now coming to the secretory phase, this secretory phase is coinciding with the post-ovulatory phase of the ovulation, and the secretory phase is under influence of both the hormones, that is progesterone and estrogen, but the most important among these two hormones is our progesterone. So what is going to happen? There is additional proliferation of the endometrial stroma. There is elongation and coiling of the glands. The glands were formed during the phase of proliferative phase. Now there is going to be elongation as well as coiling of the glands, and these glands are typically having a corkscrew appearance. That's why these glands are called as corkscrew shaped glands. Are very, very important points which I don't want you guys to miss. Okay, then these glands which are formed here, which attain the shape and size of a corkscrew shaped glands, they are going to secrete a fluid which is containing glycogen, and this glycogen is very, very important for the nourishment of the implanted zygote. If at all there is a pregnancy, and if at all there is a formation of a zygote, then this zygote will need the nourishment. So these endometrial glands are going to provide nourishment because they are going to secrete the fluid which is rich in glycogen. And as we progress into the secretory phase, already spiraled blood arteries are going to form more and more of spiraling, and now the thickness of the endometrium from roughly 3 millimeters is going to increase to 5 to 6 millimeters. So these are the important changes. See here, I have put up the two important images. One is an image during the proliferative phase, another one is an image of the secretory phase. So can you tell which is the image? Yeah, this one is proliferative, this one is the secretory phase. Here, why? Because we can clearly see here we can see the glands Okay, the glands are very much straight, and here we can see the glands, they have become like corkscrew shape. This is the most important difference. And even we can see there is more growth of the blood vessels and more growth of the stroma as well. So here we can see these glands are beautiful. A corkscrew shaped gland is what we can see, and this is the higher magnification wherein the appearance is that of a corkscrew. Okay, so this is what is called as a corkscrew shaped gland, which is typically seen during the secretory phase of the endometrial cycle. Okay, so now we have understood both the phases. After that, there is going to be menstrual phase. So why menstrual phase occurs is because there is going to be a sharp decline in the progesterone and estrogen. So if, let's say, there is no pregnancy, so if there is no pregnancy, what is going to happen to the corpus luteum in the ovary? The corpus luteum will undergo involution, and the corpus luteum is the one in the second phase, or in the secretory phase, or in the post-ovulatory phase of the ovulation, which secretes progesterone as well as estrogen. So now when the corpus luteum has undergone involution, there is a drastic fall in the levels of both progesterone and the estrogen. So there is a sharp decline. Now when there is a drastic fall in the levels of progesterone and the estrogen, there is going to be production of leukotrienes and also prostaglandins. Okay, so this causes an intense spasm. So till now there were a lot of spiral arteries. Now the spiral arteries, because of the secretion of the prostaglandins, these prostaglandins are basically going to cause vasoconstriction of these spiral arteries. So there is going to be an intense spasm of the spiral arteries, and when the spiral arteries are having a vasoconstriction, the blood flow to the stratum functionale is going to get compromised. So when the blood flow to the stratum functionale is going to get compromised, the stratum functionale layer, see, as I have told you, this is the stratum basale. Upon this, whatever is developing is the stratum functionale, and this stratum functionale are going to have these spiral blood vessels. So when there is severe vasoconstriction of the spiral blood vessels, this layer is going to undergo necrosis. That is, stratum functionale is going to undergo necrosis, and then there is necrosis which is also resulting in breaking of the wall of the arteries. Okay, so when there is necrosis, even the blood flowing to the arteries is also less. So what is going to happen? The wall of the arteries is going to break up. Okay, then there is, when the wall of the artery breaks up, whatever blood is present in the blood vessels, that is going to seep into the necrosed endometrial tissue. Fine. So what happens is, now there is separation of the necrotic tissue from the underlying basal viable tissue. So we have the two portions, the stratum basale and the stratum functionale. So then now there is a clear cut. So this is viable and healthy. Now this has become necrosed. So there is a clear cut separation of the necrosed stratum functionale from the underlying viable stratum basale. Okay, so this is going to lead to sloughing off of this stratum functionale layer. The stratum functionale is going to slough off. Okay, so the prostaglandins which are produced, they are also going to cause contraction of the myometrium, which is going to help in expulsion of this necrosed endometrial. So the endometrial debris containing sloughed off tissue, they containing blood, containing serous fluid, prostaglandin and the fibrinolysin, everything is now going to come out. Okay, so average bleeding which is going to occur in one menstrual cycle will be around 30 to 80 ml, and remember, for the bleeding to be called as healthy, there shouldn't be any clots which are going to come out. Okay, why no clots? Because it is going to contain fibrinolysin. So this is how the process of menstruation is going to occur. Okay, basically there is going to be a drastic fall in the level of progesterone and estrogen, which is going to cause an increase in the level of leukotrienes and prostaglandins, which is going to cause vasoconstriction of the spiral blood vessels, and because of the vasoconstriction, the blood vessels themselves are going to break off, and there is also going to be necrosis of the stratum functionale, and now there will be a clear-cut demarcation between the necrosed part of the endometrium and the underlying viable part of the endometrium. So now the necrosed part of the endometrium is going to slough off. Okay, so when it slough offs, it is going to contain the sloughed off tissue, the blood, the serous fluids, and it might also contain prostaglandin and fibrinolysin. So average bleeding which occurs is 30 to 80 ml without any clots. So that completes your endometrial cycle. So let me just summarize what all we have studied. We started with a beautiful definition of what is called as the female sexual cycle, or it is also called as the menstrual cycle. Then we studied the stages of the ovarian cycle, or we can also call them as phases. Please, again I am telling, don't get confused between the phases of ovarian cycle and the endometrial cycle. So ovarian cycle is having 3 phases: the pre-ovulatory phase, the phase of ovulation, and then it is also having a post-ovulatory phase. Okay, and in the pre-ovulatory phase there is basically going to be development of the follicles, and one dominant follicle which is called as a Graafian follicle is going to develop, which is going to release the secondary oocyte. That is the process of ovulation. We also understood the mechanism of ovulation and the events which occur after ovulation, and we also understood the hormonal interplay which leads to ovulation, and the most important, which we should never forget, is the LH surge and the events after that which is going to cause the ovulation. And then we understood the endometrial cycle, and the endometrial cycle is also having 3 important stages. These are the proliferative stage, the secretory stage, and the stage of the menstrual bleeding. Okay, so these are different from these stages. If at all you require a separate video on the hormonal regulation of this entire menstrual cycle, please let me know in the comment section. If this video is helpful for you for your exams, please do like this video, subscribe to my channel, and also share this video among your friends. Thank you.